Hey everyone, thank you for joining us here tonight. It's so good to see folks starting to come in. My name is Marissa. I'm one of the co-founders of Beaming Health. So excited to be here with Ann tonight. We'll go ahead and get us started. Whoop. Oh boy, whoopsies. 1 second here. All right. So Beaming Health, we're a startup focused on making every family's experience navigating autism and other developmental differences a lot easier. Our site, for anyone who hasn't checked it out yet, helps families find everything from best place to get a diagnosis near them, speech therapy, you name it, or camps. So we have that, a really fun community of families and professionals that always are active answering and asking each other questions. So everyone's welcome to join that as well. We also have an awesome learning center with different content for anyone who wants to check this out after the event. But without further ado, we share a mission with this wonderful woman here on the line, Ann Koerner. You talk to anyone, ask anyone about who knows public benefits in the United States, and Ann's name comes up again and again. She presents at every conference, and my favorite thing about Ann personally is she just tells it like it is. She talks like a human and just makes really complex, messy things a lot easier for anyone. So we're so lucky to have Ann here tonight. And Ann, anything you want to say before we jump into some prepared questions, and then we'll turn over for audience Q&A after that?
Well, first of all, thank you so much for inviting me to be a part of this webinar, and also I've really enjoyed our conversations, and I'm excited about what the Beaming team has to offer. I think it's a very exciting job that you guys are doing. National Care Advisors was founded in 2008. We exist as a group of nurse consultants to serve families that have loved ones with special needs challenges. And our goal is to find solutions, whatever that might look like, whatever is consistent with the vision for the family. So I'm very, very excited to be here and to answer questions about third-party benefits and how we can make sure that we maximize all available resources for individuals who have special needs of any kind.
Amazing. Love it. Perfect intro. All right. And for anyone who's joining us, would recommend, if you're able to, grabbing a pen and paper. I find it can be helpful to digest some of these things. And if you can't do that, no worries at all. This will be recorded, and I'll make sure to send out the recording and the slides for reference, just so everyone has that. To kick us off, and just softball, why is it so important for families to understand these benefits and get their applications into these as soon as they can?
Well, the simple answer to that is if you don't apply, no one will ever offer you anything. And as much as it does seem to be a hassle, and there is no doubt about it, that it takes time and energy to apply for third-party benefits or government benefits or even health insurance for that matter, the bottom line is if you don't apply, you will never know for sure whether or not there are certain benefits that might have significant value to your loved one, not only today, but also over their lifetime. The second thing that I always like to make sure that families understand is that eligibility for benefits can change over the lifetime of the individual. So, for example, a child that's below the age of 18 may not have access to significant benefits because of mom and dad's income and assets. But after age 18, all of that changes. Only the child's income and assets are a factor. Same thing at the time that mom and dad retire. There may be additional benefits available to their loved one based on mom and dad's work record versus the child's work record. And it is always disheartening to us when we work with a family to find that they've left maybe some significant money on the table because they just didn't know that they needed to apply at a certain time across the timeline of life.
Mm-hmm. Great advice, Ann. And while we're talking about it, just at the start here, what kinds of different things can these benefits be used for?
So I think in all cases, when we have an individual who has special needs, the largest expense is the cost of long-term care, whether that's supervision, whether that's nursing care, whether that's aid level care, whether it's financial management care. There's just a lot of things that come into a factor to have the best possible quality of life that in many cases family members provide. But when family members are no longer in a position to do that, it's expensive to have to hire someone to do that. Public benefits such as various Medicaid programs or Medi-Cal, depending on what state you're in, or Apple Care. Again, Medicaid has many names across the country, but in any case, basically Medicaid programming can provide significant assistance with long-term care, as can VA benefits, as can certain developmental disability benefits, or what we call waiver benefits. And so that's always one of the first things that we go looking for is there any amount of funding that we can achieve through a public benefit to help offset the cost of the long-term care needs, not only in childhood or young adulthood, but also after mom and dad are no longer in a position to be able to provide that same level of care that they've, in most cases, done most of their lifetime. Also, public benefits can, of course, be a wonderful resource for health insurance. So Medicaid, Medicare, VA programs can be super, super helpful to take the place of private health insurance or employer-sponsored health insurance if those costs become prohibitively expensive. Public benefits can also help with vocational services, socialization, day programming, transportation. In some cases, in some states, it can help with home modifications or the cost of modifying a vehicle. So there are a lot of different programs that are available, and we want to make sure that we explore them and maximize them for every client that we have that fits the criteria and eligibility requirements.
Love that. Makes sense. But I know, like even you just said there are just so many different kinds to talk about. I'm sure it's super overwhelming. I know for the families you work with, for my family, for families here, just starting at a high level, what are some of these different types of benefits? And just for everyone on, we are going to get into sort of what are the things you must look at, if nothing else, just leaving today. So we'll make sure to work our way down to some specifics.
Sure. So to just start with some terminology here, when someone says means tested, that's just a fancy way of saying there's an income and in many cases an asset requirement in order for an individual to receive that benefit. So that means that they can't have much money. They have to be in some level of poverty. So for many of our clients that have special needs, they're not capable of working and earning significant income. Now, that doesn't mean they can't work, but they're not earning enough income to support themselves. And so it's not difficult to meet those criteria for what we call means-tested benefits. Examples of a means-tested benefit would be supplemental security income, Medicaid, Medicaid waivers, Affordable Care Act insurance subsidies, housing assistance, Section 8 vouchers, those type of things, food stamps or EBT benefits, utility assistance, and transportation vouchers. There are also some VA benefits that are also means tested. So it kind of, again, we like to explore those if the VA, if someone has a service record or a parent has a service record and their child was determined to be disabled prior to age 22. But these are the big ones that we almost always want to explore. And again, there would be some type of restriction on the amount of income and asset. By the way, those income and asset eligibility criteria are so depending on where you live or if you decide to move from one state to another, we often want to make sure there aren't any surprises that you might lose a benefit or leave a benefit on the table depending on where you move.
And it cut out at a very important part.
Oh, I'm
sorry. So you said, I think you said, depending on the state, those vary. The eligibility criteria vary by state, what that exact line is. Is that right?
Correct. So it's important to understand, but that the Oh, hopefully that did not happen. Can you hear me now? Okay. So the means tested, the income and the asset eligibility criteria may vary from state to state. It is not standardized.
Mm-hmm. Got it. And then is there a good or easy way to figure out in someone's state, for example, what that criteria might be, or does it vary by benefit?
Well, again, I certainly wish that the terminology and the programs were standardized across all states. It's important to understand that Medicaid is funded approximately 60% by the federal government and 40% by the state governments, and it is administered at a state level. And so each state has the ability, while they have to provide a minimum amount of programming, they can certainly provide more. They can name it anything they want. And in some cases, it's administered by a Department of Human Services, Health and Human Services, or in other states, it might be, they might have a specific Department of Developmental Disability Services, might be Public Welfare Services. In general, what I would suggest is that if you Google developmental disability benefits in a given state, you will be directed to a state website that is appropriate for that particular state, and that's a good place to start. It's not quite as easy as you think, although, again, there are certainly plenty of social workers and case managers out there that can also help direct you. But usually to start with the state Medicaid department is also very helpful.
Love it. And on the flip side of the coin of means tested, we also have the other type of benefit.
Correct. There are other benefits that are important to understand, and those are benefits that you are eligible to receive regardless of your income and asset. And by those, I'm thinking about Social Security disability income. And under that, also, there is retirement Social Security, dependent Social Security. So one of the things is if a child is determined to be disabled prior to age 26, and the parent becomes disabled or retires or is deceased, that individual with the special need or that's determined to be disabled, their child, it might be an adult dependent child by then, is going to receive a dependent Social Security benefit based on the parent's earning record. That is not subject to any income or asset test whatsoever. And it can sometimes be pretty significant, $1,500, $1,800 a month, depending if the parent was a fairly high wage earner. So that's important to understand. Although the child would not be eligible unless the parent themselves started to draw their own Social Security, either because they were disabled, retired, or deceased.
Can you say that last piece one more time?
Okay. They would not be eligible to receive the Social Security benefit of the parent until the parent is either determined to be disabled or is retired or deceased. Okay. With Social Security disability or dependent benefits, Medicare comes. And Medicare is a wonderful health insurance program, despite the fact that some folks like to think that it's not so great. But in general, it's a fairly generous health insurance policy. And so we often have children who are disabled, adult children who are disabled, that ultimately receive Medicare because they're receiving a dependent Social Security benefit based on their parents' work record. Medicare will come into play approximately 2 years from the time that the individual is deemed to be eligible to receive that Social Security dependent benefit. And we often see this when, for example, an individual with autism or Down syndrome is in their 40s or 50s, and mom and dad are now retirement age. So now we have both Medicare and Medicaid, perhaps, and a higher Social Security benefit than we did prior to the parent retiring.
Gotcha. All right. What would you say? So that's awesome. There are all these different benefits. Definitely a lot of work to figure out what's most important for each individual, depending on their situation. But are there any in particular that you think, oh yeah, if you're going to look at a few, definitely look at these that tend to be most impactful for a family?
Well, there's no doubt that Social Security is very important, and whether it's supplemental security income, which is again income and asset dependent, but that can provide up to the maximum amount in 2022 in most states is $841 per month. No one wants to turn their back on $841 a month. And so in most cases, after an individual with a special need reaches age 18 and their parents' income and assets are no longer a factor, we are going to be able to help them to become eligible for supplemental security income. In some states, there's additional benefits. So for example, in California, we have another state supplement to that, and the maximum supplemental security income is actually $1,040 per month. There's some supplements in New York and a couple other rather expensive states. So again, that starts to be some money that makes a big difference. And once that individual receives their supplemental security income, it is to be used for essential housing, utilities, and food. If that individual is living in the family home, they certainly can pay rent to their parents. Once the parents receive those funds, then they can turn around and use it for any kind of support service, anything they want to help support their child with special needs and to meet the needs of the household. So I do think that Social Security is an important benefit to look at, supplemental security income. And then, as I said, Social Security disability income can even be much higher than that. Often we see $1,500, $1,800 a month based on the parent work record. And so that's important to have that income stream. And there are no restrictions on how you use Social Security disability income.
Oh gosh, that's awesome. Awesome to know. We had some questions come in here. Yeah. Clarifying around these. These are great, Anne. Thank you. So the first clarifying question. So a person with autism wouldn't get dependent Social Security income until the parent starts collecting Social Security?
Correct.
Is that
correct? Right? Unless the individual was very high functioning and they were able to, at one point in their life, and they were able to work and pay enough quarters into the Social Security system through withholding, tax withholding, then they could get it on their own right if they then subsequently became, more disabled with aging process. But most of the time for individuals with autism, they're not going to get that parent's dependent Social Security benefit until after mom or dad start drawing their own Social Security because they either became disabled, retired, or deceased. I see here, so how impaired does a person have to be to qualify for SSI? So the individual has to be able to meet the federal definition of disability, not the doctors, not the social workers, not the parents, but the federal definition of disability. And the federal definition of disability means that that individual is not able to sustain meaningful employment. So basically, they're not able to support themselves. And that the disability is expected to continue for more than, for the foreseeable future, basically. That's layman's terms. There are certain other criteria. If there's a vision disability, having a hearing disability doesn't get you anything with the federal government, but they do have special criteria for individuals that have significant vision loss or blindness. It is very important, if you are helping your child or loved one apply for supplemental security income, that when you talk to your doctors and therapists, they are going to be asked for documentation to support why that individual cannot sustain employment. The diagnosis of autism is what's called it's a presumptive diagnosis. So generally, we do not have problems with Social Security approving that disability status, but they will ask for supporting documentation. And we want to make sure that everyone is providing documentation that addresses the functional disability that interferes with sustaining employment. So it might be organization, it might be communication, it might be anxiety, it might be difficulty following more than a 1 or 2 step task, it might be behavioral challenges, it might be personal care challenges. So we really do want to be very specific about what are the functional deficits that preclude employment. When you're talking to the Social Security Administration, you want to present the individual on their worst day, not on their best day, in order to maximize those benefits. And so often we will help the doctors to make sure that they're not just giving a diagnosis and a list of medications. We really do want the physicians and the therapists to write what are the functional disabilities that are precluding employment.
That's so helpful, Ann. Any other questions before we move on? Oh, yes. Let's see. Ann, you can see these two.
I can. So the question is, if a child with autism qualifies for supplemental security income and then ultimately gets a job, they will lose supplemental security income, correct? And the answer is no. The government wants individuals with disabilities to be able to work. There are special considerations for individuals with disability that are working. And so we are allowed to offset their wages by the value of the services, support services that are required to enable them to work. So for example, if they need a job coach, if they need transportation services, if they need someone to help them get up and get dressed and get to work on time, if they need someone to help them manage their paycheck or to manage the communications about time off. There are all kinds of different, if they need adaptive technology of any kind, certain like adaptive computers or those kinds of things. There are a lot of things, and we call those work-related expenses. And if you really want to understand a little more about working while disabled, there is a wonderful guide called the Social Security Red Book. And if you want to Google that, you'd Google it, make sure that you're on the Social Security website when you Google whatever comes up, but you'll ask for the Social Security Administration Red Book 2022, and it will give you all kinds of guidelines about how to continue with the supplemental security income as well as allowing that individual to work, especially and we all know that work is so important. It's important for self-esteem, community involvement, socialization, and just the pride that comes with being able to do something meaningful for life. So luckily, our government does realize that, and they are willing to, they understand that sometimes we still need supplemental security income in addition to the wages to meet the living expenses for an individual with special needs. So one of the other most important benefits for families to be aware of, as I mentioned a little bit earlier, are programs that assist with long-term care or supportive in-home care, which is always the most expensive line item. And so those services are often provided through special kinds of programs that are called waiver programs. Now, these waiver programs, you may have heard, depending on where you live, there are sometimes, in some states, they've been called the Katie Beckett waiver. They may be called a home and community-based services waiver. There are autism-specific waivers in some states. In other states, they're just developmental disability waivers, and they're not specified by diagnosis. But these types of waivers are usually in the state of California, for example, they're administered through the regional center. And so they don't even use the term waiver, but that's basically the same program that in other states would be called a waiver program. waiver means it waives the usual asset and income requirements for Medicaid benefits. And it also provides benefits that are beyond the usual Medicaid programs. And in many cases, these waiver programs will allow, for example, if you have a child that is profoundly disabled, it may provide home health aid services without regard to mom and dad's income and assets. So it waives the usual asset and income requirement. But these can provide significant home health aid or respite care. In some cases, for example, in California, 283 hours a month is the maximum that you could receive. That's about 45 or more hours per week, or that's a lot of care. In a lot of other states, again, there are programs they can provide anywhere from 5 to, again, 40 or more hours a week, depending on the severity of the need of the individual. And so that those programs also have priority and urgency of need criteria in many states, which the term you might hear sometimes is a PUNS list, which stands for priority and urgency of need. In general, the way that works, for example, a single parent or a deceased parent, the child of those parents will get services before the child with a two-parent home where there's adequate resources. On the other hand, if you have a child that never sleeps through the night, has destructive behaviors, is very challenging, that child may get a lot more hours than the child that sleeps through the night, but still needs supervision significantly more than a typical child of that age. So those waiver programs are worth exploring, and developmental disability waivers. Again, if you Google developmental disability waivers in your state, it is likely that you will be taken to the state website. Make sure it's on a reputable website, and it will explain what programs are available.
Mm-hmm. Love it. Let's see, a question coming in here. And this is great. Keep the questions coming. So in our state, the HCBS waiver services for ABA ends at 21. Is this true across all states, or are there other options to continue ABA therapy, maybe in other states, I'm guessing?
Well, so first of all, there is not equity across all states for any type of ABA therapy, despite some recent mandates. Certainly, there are some new laws that say that insurance has to pay for ABA and the Medicaid programs have to pay for ABA. But it is not uncommon that if there is not significant forward progress, those ABA services will be cut off at any time. It's kind of an interesting problem that we see on a regular basis. I am not aware of any state that provides intensive ABA or any other types of therapies after age 21. And in fact, often they're cut off more around 15 or 16, not age 21. There's certainly supportive behavioral therapy that might be applicable if there are significant challenging behaviors that need to be addressed. And those certainly can be paid through Medicaid and other health insurance. But in general, I would not be optimistic that you would find a state that would provide ABA beyond age 21. In general, there is the many professionals, and certainly at the state level, believe that by the time you reach young adulthood, most of the gains have been made through intensive therapy at that particular point. That doesn't mean that there are not adult support programs, though, that will provide trained caregivers that understand the basics of therapy and how to manage behaviors and are willing to be trained. The waiver programs often are segmented into children and then adults. Just because one waiver ends, there is usually another waiver that will take over at adulthood, but it may have slightly different benefit levels than what the one in childhood provided. You want to talk to your waiver coordinator in your state to fully understand what's available to your child in adulthood.
And then question here about Medi-Cal specifically. Is it true that that waiver program ends at 18?
Oh, no, not at all. No, not at all. And I assume that you're talking about regional center services. Those continue for lifetime, and they are not income or asset sensitive in California. California is one of the most generous states for sure. But no, those waiver programs do not at all end at age 18.
That's awesome.
It may be called something different. But again, if you're talking Medi-Cal in California, which is Medi-Cal is the specific, California calls Medicaid Medi-Cal, but for the types of waiver that we're talking about, that those would be administered through the regional center in California, and those benefits continue throughout adulthood. They do not stop at age 18. And there are other programs like in-home support services. That's actually kind of a waiver program. It's just called something different in California. That continues through adulthood. And again, if you had a child that, well, we're talking autism this evening, but if you were talking about a child that had, for example, physical disability, for example, a tracheostomy or a ventilator or those types of things, there's another type of waiver called a home and community-based services waiver that will also continue for lifetime. There's no age limit on that.
Awesome. And this is super helpful. Yeah, definitely keep the questions coming. And
sure.
I know we're all thinking it. Are there common pitfalls that you see with families? For example, I know losing means tested benefits comes up a lot.
Sure. So as I mentioned, one of the most common pitfalls during the application process is being a little stoic. So as parents and families, we spend so much time advocating and talking about all of the successes and the wonderful things that our children do, that, you know, they're beating the odds and they're learning more and they're doing, you know, they're just succeeding in some levels, and you want to talk about their successes. And you want to basically say, in most cases, you know, families say, gosh, we got this. We're on top of it. I am the mother who is going to make sure and advocate for my child. And I think that I am handling it all just fine. Unfortunately, that is not what you want to say when you go into a government office and you are applying for benefits of any kind, whether it's Social Security or Medicaid waiver programs, or regional center, whatever it is, developmental disability programs. I highly recommend that as you are talking to case managers and coordinators and you're applying for benefits on behalf of your child, you again talk about not only your child's worst day or your family member's worst day, but your worst day, because the squeaky wheel gets the benefit. And I know that it is extremely challenging. And in many cases, there are those days where you're just exhausted and you're just like, I'm not sure I can keep doing this another minute. And if you express that in very clear terms, you are likely to get much more benefit and much more support than if you go in there and say, well, I've got this. It's really not that big of a deal, or whatever. You're not going to know exactly what someone's willing to pay for unless you express very clearly what it is you're asking for and what would help you most. I think one of the other pitfalls is perhaps underestimating the value of services based on what is perceived to be the hassle factor. So I will often have a parent tell me that Medicaid is just painful. It's hard to get approvals. They don't pay for anything. They're not using the vendors that you want to use. And so, yes, based on anecdotal, one-time kinds of things, yes, absolutely. Medicaid is a bureaucracy to beat all bureaucracies. But in many cases, Medicaid is paying 100% for doctors, no copays, no deductible, no premiums. Medicaid is paying 100% for prescription medications, no deductible, no copays, no premium. Medicaid is paying 100% for diagnostic testing. So if your child ever needs a chest x-ray or a blood work or any of those things, no copay, no deductible, no premium. If your child's ever hospitalized, heaven forbid they get in an accident or they have some type of significant health concern, Medicaid will pay 100% of that hospitalization. And generally speaking, across the nation, most major medical centers, the best of the best, all participate in Medicaid. So you're not restricted. You don't have to go to some, hospital that's not of high quality. You can go to Stanford. You can go to the best of the best, and they will accept Medicaid. That's assuming you have Medicaid in the state where that hospital is. So that is one of the problems. But in any case, in your state, you can go to the best university medical center or was the expert. And so I think sometimes it's hard because you might have fought for a wheelchair, or you might have fought for therapy services or ABA services, or you might have fought for especially behavioral therapy or psychiatric care, that you forget about all of the good stuff that Medicaid does. The other thing that I sometimes find is that parents think that because I have Medicaid, I can't pay privately for anything. I have never known a state to say that you can't pay private for something. So if you find out that Medicaid is not getting the job done, it's not giving you a quality service, and you have to pay privately, it is what it is. But still don't turn your back on all the other good things that Medicaid is doing for you. That's important. I think another pitfall is not understanding how to manage those means tested benefits. So keeping the income under the level, or making sure that we don't have any asset problems. So supplemental security income, the individual in generally can't make more than about $1,000 a month. That's kind of the good cutoff. It's a generalization, but that's about it. And you can't have more than $2,000 in the bank. Sometimes what we see is that parents started a college fund when the child was very young, and that college fund is now well over $2,000. They go to apply for supplemental security income, and Social Security will cross-reference with the IRS, and they are going to know that there's a bank account with more than $2,000 in it, and the child will be found ineligible for SSI. That money needs to either be spent, or it needs to be placed in a special needs trust, which is federal law that allows for an individual with special needs to shelter assets in this special kind of trust so that they are no longer considered in the eligibility for supplemental security income or Medicaid or any other means tested benefit for that matter. So we also see sometimes where a child with special needs will inherit money from a grandparent, an aunt, an uncle, even a parent. And all of a sudden that inheritance will interfere with means tested benefits. It is very important to talk to all of your family and say, wow, we would love if you want to leave some money to our child with special needs. We think that's a great idea. Thank you so very much. But could you please leave it to their special needs trust, not to the child themselves? And certainly there are special needs attorneys that can help you to figure out that estate planning and to make sure that all of your legal documents and wills and successor guardians and trusts all make sense and preserve access to these valuable means tested benefits. As I mentioned, working does not preclude these benefits, but you do have to submit what the offset of the expenses are if the individual is able to make more than $1,000 a month. Sometimes that's a problem because we do find really great employment, and then we need to work that through.
Any questions? Ann, you said a lot of really good stuff. I know one question that came to mind for me back when you were talking about Medicaid and how it can cover lots of services and be worth the hassle, was curious, can an individual or child be enrolled in Medicaid if the parents have, say, commercial or an employer covering their insurance?
Absolutely. It's very, very possible to be what's called dual eligible. Medicaid is by federal definition, so this is in all 50 states, Medicaid is the payer of last resort. So what that means is that the private health insurance that's provided through a parent's employment or through, Affordable Care Act for that matter, would be primary. and the individual with Medicaid would have Medicaid. The Medicaid would be secondary. So it'll pick up copays, deductibles, assuming that the vendor is in network with Medicaid. And that sometimes can be a problem because the Medicaid network might not be the same as the private health insurance. So you're going to want to check that. Not usually a problem for hospitals, but it can be a problem for specialists like psychiatrists, plastic surgeons, OBGYN. There's certain specialties where there are doctors that have opted out of Medicaid because they don't need it. They've got plenty of business on the private health insurance side and they get paid more on that side. So you're going to want to check if you're anticipating that you want Medicaid to coordinate with your private health insurance. You're going to want to check with the vendor, the service provider, before you make that assumption. Also, many providers won't automatically submit to two insurance sources. So they'll send it to your initial insurance, and then you have to jump through some hoops to send in the explanation of benefits, the receipt, the proof of payment from your primary insurance provider, and then send the rest over to Medicaid. And that can be a bit of a hassle. In some states, it's more of a hassle than others. Some states do have some arbitrary rules about that, but in most cases, individuals are allowed to have both private health insurance and Medicaid. By the way, in all cases, children now in the United States can have insurance coverage under their parents' policies through age 26, regardless. I mean, healthy, disabled, whatever the challenge is, or typical, whatever. After age 26, if the parent is working for a large employer, there are often what's called dependent, disabled, adult child benefits that will allow for the parent to continue to purchase family coverage beyond age 26. And it generally only requires a simple letter from the doctor saying, in this case, let's say the child has autism and they're now 27 years old and you don't want to drop that coverage because you really like your health insurance coverage and you're willing to pay the family premium. You can submit that letter, and in most cases, fairly large employers will offer that benefit. And it's worth looking into in many cases because private health insurance does, especially if your therapist or psychiatrist or behavioral counselor takes your private health insurance and they don't accept Medicaid. So we do see that from time to time.
Wow, that's awesome advice. Thank you, Ann. Yeah, moving on here. For anyone I know, that was a lot of information to take in. I know folks live in a lot of different places, but if there are specific questions that have come up throughout, or if there's anything Ann can repeat, I know a lot of these things are complex. So if there are any questions here, feel free to throw them in the chat. Yeah.
One of the things that I think we see while we're waiting for a couple more questions to come in is that individuals think of Medicaid as one program. And Medicaid is actually made up of multiple programs. There are specific programs for individuals that are elderly. There are specific programs for married individuals where one of the spouses becomes disabled. There are specific programs for individuals with developmental disability. And again, in some states, there are autism-specific programs as well. So it's very important to, as you're applying for Medicaid or you're exploring Medicaid benefits, that you're not making assumptions because, maybe your grandparents said, oh my gosh, Medicaid was just a really royal pain for us. Well, that's a very different situation in the elder care world than it is in the developmental disability world. And the value of the benefits can be significantly different as well. So I think that's important to understand.
Definitely. Great question that comes in here. So who should we reach out to when we approach retirement age to understand what they should do at that time?
Well, boy, that's a big question. First of all, I might suggest that you don't wait till retirement age. We generally suggest that families with a special needs loved one would start that planning process at a minimum when that individual with the loved one is in the 15, 16 years of age. Because you're going to want to take a look at, okay, what is your vision? What is it that you'd like to accomplish? And what happens as mom and dad start to age? So not only looking at retirement, but in almost all cases now, children with special needs are going to outlive their parents. The day where a child is going to predecease a parent, we used to hear that quite a bit. I still do hear it every once in a while. And I always want to like kick the doctor that said that, because given today's medicine, we are finding that individuals with special needs live a fairly normal life expectancy. So what I would recommend, whenever the time is that you've said, oh, wow, I think we need to start doing some planning. You might want to look, there's an organization called the Special Needs Alliance, which is a group of attorneys who specialize in this type of guidance for estate planning and trust development, and can really guide you. And that's called the Special Needs Alliance. Again, if you were to Google the Special Needs Alliance, it will come up. They have attorneys in all 50 states. And that would be a good place to start to find a knowledgeable lawyer that might be able to help you with your planning process and your documents. You might also, if you have a financial planner, talk to your financial planner. Many financial planning organizations have knowledge about special needs planning, and they often have relationships as well that could point you in the right direction. In some cases, the state case managers and coordinators or your county developmental disability case managers may help you. I have to say that sometimes I don't find them to be as knowledgeable if they have quite a bit of resources. But sometimes they can be very helpful. Certainly, you're welcome to call National Care Advisors as well. We certainly provide that service. And if you don't want to actually work with us, we certainly can point you in the right direction as well. But it is important to not only define your vision especially when you're no longer here, to do all the good things you're doing now for your loved one, but also to identify the associated costs and to figure out how you can not only leave funds behind, but leave them in a way that maximizes their effectiveness for your loved one, and you actually accomplish your goals through your legal documents as well. So,
great questions and advice. And another question in here: it seems like so many people are denied SSI despite disability. Is it necessary to hire a lawyer to apply successfully?
No, it is not necessary to hire a disability lawyer to apply for SSI. And when you hear about someone having difficulty applying for SSI, it is usually one of two reasons. They did not provide the financial documentation, so the bank statements that were requested. So you need to provide a savings account, a checking account, any kind of retirement funds, and they didn't meet financial criteria. And that will be spelled out in the letter from Social Security. There's no secrets with Social Security. They'll tell you exactly what the reason is. But if you fail to respond and they ask for more documentation and you don't submit it or verify that it doesn't exist, so oftentimes we don't have a savings account. Well, we just need to say, there is no savings account. You have to respond to the request for financial documentation. The second reason people are denied supplemental security income is because the medical documentation did not address the functional reason why that individual cannot work in any capacity. And that's what the federal definition says. So, for example, if you were working in a very manual labor, physical activity job, and you throw out your back, Social Security is likely to say, well, I realize you can't go back to your original job, but there's no reason you can't work in a sedentary job now, and so you are not disabled. And so, again, if the doctors don't talk about and address the functional disability, then Social Security is always going to err on the side of, well, you can work in some way, even if you're a greeter at Walmart. And that is the philosophy of how they look at Social Security applications. So, for example, let me go further with that example of the person with the bad back. you have a bad back, the reason you really can't work isn't because your back is bad in any capacity. The reason you can't work might be because you have a lot of narcotic medication and you can't drive and you can't think straight because your pain level is so high that you can't possibly even be a greeter at Walmart. That's what I'm talking about with functional disability. But the idea of just having a bad back and now I can't work at all in any capacity, yep, you're going to have a problem unless you go one step further to say exactly why that precludes you from working in any capacity at any job. Now, when there's intellectual disability, as I said, there are presumptive diagnoses. On that list is autism, Down syndrome, cerebral palsy, multiple sclerosis, lots of serious cancer diagnoses, Lou Gehrig's disease, muscular dystrophy, many of the major childhood disabilities, you're not going to have any problem. And there is no real challenge in applying for SSI for a child with autism in the majority of the cases, based on my experience, if the appropriate paperwork is submitted. Now, one of the other things that I see is that sometimes the individualized education plan through the public school district suggests that that child is far more functional than what's really happening in real life. So, for example, if the individualized education plan doesn't talk about the fact that the child needs to be verbally cued to pay attention, or that the child can't complete more than a 1 or 2 step task, or that the individual can't toilet independently, or that the individual can't communicate effectively, or has significant anxiety and behavior issues that preclude socialization and being able to be in the work setting, and that IEP says that that child's getting all A's and B's and has met all of their goals, that's not a good document to support that they're disabled. And so you really need to look at the documents that you're submitting and make sure that they really are accurate about the reason why that individual cannot sustain significant remunerative employment. That's what the terminology is. But bottom line is that they can't be employed in a capacity where they could actually support themselves above the poverty level. Does that help? I hope. We find, and the other thing too is that if you're denied supplemental security income, one of the first things that we look at is why. Was it because of financial reasons or the disability determination? And what was actually submitted? If you appeal that decision, it will take you 2 years because there's a huge backlog to hear appeals. What we recommend families do is that we wait about 6 months. We reapply with good guidance, with all of the financial documentation. We sometimes will actually write the functional letter that we want the doctor to sign, and we'll ask him to edit it, put it on his letterhead and sign it. And so we know that we've got the exact, realistic, good, solid medical data going into Social Security, and we are successful almost always. It is extremely rare for us to recommend that you hire an attorney. Very rare. When you hire an attorney, Social Security will pay the fee, but again, it's going to take you probably 2 years or more. And sometimes it's a pretty simple fix.
That's super helpful, Ann. Thank you so much. Another question here. We have a grandparent who is a wonderful grandparent and wants to pass down her small home to her autistic grandson so that he has housing as an adult. Will this be a factor into qualifying for SSI despite it not being liquid funds in an account per se?
Okay, so for purposes of supplemental security income, the primary residence and 1 car is not counted as an asset. So that is not a problem. So certainly individual with special need can own a house and they can own a car. Not a problem with supplemental security income. However, I would suggest that you really talk about a plan for the housing for your child with autism or the autistic grandson. Can that individual actually manage a home? Are they going to be able to arrange to have the gutters cleaned out? And what if the toilet gets plugged up at midnight on a Sunday night? And what if the furnace goes out, and you see where I'm going with this, right? And so we need to not only plan for the housing, but also who's going to actually manage the house, assuming that the grandson outlives his parents and the siblings have their own marriages and their own lives and their own children. Now, there are certainly management companies that will do that. And certainly we do have parents and grandparents that will provide a actual house with the idea that it will become a small group home, and there might be someone else living there or someone else would be managing it, which is a great idea. It's kind of a private-public consortium. You kind of use the best of your public benefits and the private housing that the grandparent has provided. But you do have to have a plan on how you're going to manage that, and then who's going to provide the supportive care and who's actually going to live there. You also have to have a plan to cover the property taxes and the homeowner's insurance, and like what happens when the roof blows off or you need a new roof. And if that grandson only has an income stream that is supplemental security income, could be that there's not going to be enough income stream to support that house. So just leaving a house alone without the bigger plan and perhaps funding a special needs trust to support the house, that would be something I'd really want you to talk through with a good estate planning attorney to make sure that you've thought through all of the aspects of that. A lot of times we recommend a low maintenance condo, single story, can be modified, has no maintenance, very low maintenance, perhaps reasonable HOA as a better option than a freestanding house. The other thing that I always like families to consider is that we always want individuals with special needs to live as inclusively as possible in the general population, for sure, in the community. However, putting an individual with special needs alone in a home in the general community can be significantly isolating. It would be nice to think that everyone's going to have neighbors that check in and they're going to be inclusive and they're going to be wonderful. And the reality is that sometimes is not the case. And so we have to have funding to provide support services to enable and support the individual with the special need to become integrated into the community and to participate, because they can't do it on their own and they're not able to establish friendships on their own. So again, there's a larger vision, and I do think it's a wonderful thing when grandparents want to leave a house, but I think that you need to kind of include that as part of a bigger plan for care and quality of life over the entire lifetime of the grandson that has autism.
And this is so tremendously helpful. If no one else has other questions, one that came up for me, as a sort of last question, is you talk a lot about vision, or a family's vision for the future. Can you share a little bit of how a family might go about that process?
Yes. Our philosophy and what we've developed at National Care Advisors is basically a process for special needs planning. And the first step to that, it's basically a three-pronged process. One is to develop the vision. The second is to identify the costs that are associated with that vision, and again, over the timeline of life. So as a young adult, as a middle-aged adult, and then end-of-life care. And then the third prong is to make sure you're using a team, which includes the financial planner and the estate planning attorney, as well as a very qualified case manager who understands benefits and real-life costs at each stage of life. It's very hard for parents. For those of you that have young children, I'm sure you remember looking at a baby saying, gosh, I wonder what they're going to be like as an adult. We can't be objective as a parent. I can tell you that I certainly wasn't objective about what my 3 sons were going to be as adult men. And but as a nurse, I can tell you what the aging process is, given a set of functional challenges. Again, myself and my colleagues have worked with enough folks that we know what that looks like when they're 50. We know what it looks like when they're 70 or 80. And what the associated care needs are going to be. So the first step is to say, where are they going to live? Who's going to provide that day-to-day support? Who's going to provide the financial management? Might not be the same person. Who's going to make sure, who goes to the doctor with them to make sure that whatever the doctor's recommending, who's going to make sure they get to church or to social or community activities, whatever is your preference. And how are they going to pursue their hobbies and their interests? What's going to happen at the holidays? What is going to be the impact on the successor generation, the siblings, and their marriages, their careers, their children, and they're going to be very busy people. What is that vision? What's going to be the involvement? And then what are the associated costs? What can we expect out of third-party benefits that we talked about during this session, whether it's Social Security, Medicare, Medicaid, or developmental disability benefits, or VA? And then how do we ensure that that vision is actually accomplished is through not only doing the legal documents, so having a plan and an estate plan and establishing perhaps a trust, and also providing the funding to support. And it's my personal opinion that the best gift that you can give to your other children is to do that special needs planning for your child that has the special need for the next generation, because there's nothing worse than developing a vision but not providing the resources to help the next generation actually accomplish it. So that's the basic process. It takes some time, and it also has to be updated annually, because as we all know, there are so many variables in life and none of us have a crystal ball. So once we have a format, an organized format, then you can review it annually, and then you can update it as things change that we can't even imagine. But there is a way to do this, and I do think that we can really achieve some very high quality of life for all if we kind of think through the process and we maximize all of the resources that are available to help us.
Awesome. Thank you, Ann, and thank you everyone for joining us tonight. Ann, this was so helpful. It's such a treat to learn from you as always. And yes, there will be a recording. We'll send out both the recording, the slides. I'll also do my best to summarize some key takeaways from it all. But yes, I know that was a lot. I'll probably need to read it myself. Awesome. All right. Thanks, everyone.
Thank you so much. My pleasure. Bye-bye now.